I call sacroiliac joint dysfunction the great mimic of sciatic pain. And the reason is because a lot of times if your SI joint is out of alignment or sprained or strained, or it's not gliding properly on its plane of motion, which is an oblique plane of motion, then it's going to cause pain right here that mimics sciatic nerve pain. So a lot of times people come in and say, I have sciatic nerve pain, no one's been able to help it. Well, one thing to consider is maybe the SI joint isn't setting right. Some of the things you can do to test that is standing on one leg, and if that makes it worse, that's usually an SI joint pain situation. So at our office, we always try to be thorough with our diagnosis and our treatment and make sure that we can get everyone feeling as best as possible. And so when we discover that it's an SI joint dysfunction, we want to get in there and work it. So the first thing to do is to work the ligaments around the SI joint. First of all, the long dorsal sacral ligament here, the lumbosacral ligament coming across the SI joint, so the SI joint is here, and you've got your sacrum here and your two hip bones here, obliquely oriented. So we want to work long dorsal sacral ligament, we want to work lumbosacral ligament, we want to work sacrotuberous ligament, which goes to the bottom part of the hip bone there. And then after that, we want to stretch the psoas and iliacus on the front part of the spine so that the leg can ambulate properly. Then we're going to work the QL here, which comes down and attaches along the crest of this hip bone. Then after that, we're going to get a gentle adjustment and get your hips back into alignment. Once that happens, usually the SI joint pain immediately subsides. And usually if it's a sprain strain type injury, it will also need a little bit of a bracing. So we recommend an SI joint belt, which is like a back brace, but it's thinner. It goes right around your SI joints and clamps them down. We also have two exercises that we would recommend. One is where you're going to lay on your side, bring your lower leg up into a 90 degrees, and then rotate inward like this. This is going to help clamp down your SI joints. Then the other one is where you're going to turn around with that SI joint up on top, and you're going to open it up. It's called a clamshell. And again, we're trying to clamp this down there to stabilize your SIs.